Hi, Dr. Sharmina here. So we're going to talk about vaginismus. Now, vaginismus sounds like something very scientific, something very medical, but it's actually something that affects many women, but it's not talked about. So vaginismus is when a lady feels very uncomfortable. They have this fear of anything penetrating the vagina. So basically, it's not something that they can control, but just the idea of something going in scares them. So it's an automatic reflex where when they're maybe trying to have sex, the muscles around the vagina just clamp up. It tightens, and then it'll be very painful and they cannot have sex. Now this is something that affects many women, but of course it's not talked about in our society. A lot of people ask, why does this happen? Now, no one really knows why someone has vaginismus. It's a multifactorial kind of thing. It could be that someone who has previous trauma to sex, so they're scared after that. It could also just be because, socially, we've been taught from small that, don't put anything inside, don't touch down there. So these are all things, possible reasons why it could happen. But to say there's a specific reason, no, we don't know why. Okay. Now, what are the common symptoms? Now, some ladies, they don't know, they don't realize they have vaginismus. They go throughout their whole life without any problems until they get married. And the first time they have sex, they want or try to have sex, they're unable to. No penetration occurs. So this causes a lot of stress to them. All right. Now, there are some ladies who, maybe they want to try a tampon for the first time. So they try inserting a tampon and they just can't insert it. So these are symptoms that are common with vaginismus. It doesn't necessarily mean that a lady cannot be aroused. They can. It's just that they have this phobia, this fear every time something wants to be inserted from below. Now, after having all these symptoms, a lot of couples get very frustrated and they wonder, can this thing be treated? Now, it can be treated, but it takes a lot of patience. It's usually treated by multiple ways. The first is a lot of counseling needs to happen. There needs to be a lot of counseling regarding sex education, and how to approach sex. Okay. Now, counseling usually isn't just given to the woman, it's also given to the partner, the man as well, because the man also will need to understand that it's a very slow process for her to get used to having sex, to have penetrative sex. So counseling is one, and also the next is to desensitize the lady, the patient. So desensitizing means that she has to get used to having something being inserted there. So the first process may just be touching, nothing going in, and slowly, little by little, penetration. Now, penetration doesn't initially mean straight away sex. It could be penetration with a small dilator. It could be penetration with finger. And of course, every time we do it, plenty of lubrication. Yeah. All of this can be treated with a gynecologist. We also use counselors. We also use sex education, sex therapists to treat this. It can be treated, but it takes time and patience. The earlier you see a doctor, the better. Hope that answers your question for today. Vaginismus. Bye.